Hello everybody. Today we'll be discussing about dengue and its homeopathic management. This we're discussing right now because of the recent increase in the cases of dengue, and therefore we'll be discussing not only about dengue's pathophysiology but about its classification and lab investigation. So for the better retention of the subject and the homeopathic medicine management, like my former video, acidity and homeopathic management, I'll be dividing this particular subject into two parts. Part 1, where we'll be discussing about dengue, its symptoms, pathophysiology, classification and lab investigation, and part 2 about homeopathic management. Dengue fever. We all know that dengue is caused by the bite of mosquito. Now, this is a mosquito-borne disease caused by dengue virus named Flaviridae flavivirus. The incubation period for this is about 3 to 14 days. Incubation period means the day from we got the bite or we have been exposed to the virus to the day we get to see the symptoms ranges between 3 to 14. Now, the symptoms. So, Wikipedia actually has given a detailed version about these symptoms from which I have made notes. So, dengue fever basically is divided into 3 phases: febrile phase, critical phase, and recovery phase. 80 to 90% of dengue fever cases falls under this febrile phase and gets done. The virus runs its course and we get back to the health, which will be lasting about 4 to 7 days. Some cases, however, get severely affected and they move on to the critical phase, then to the recovery phase, each lasting for about 2 to 3 days. So let us see one by one. The febrile case, here the fever has a very sudden onset and high temperature also, about 104 degree Fahrenheit. Headache along with the fever, severe headache, behind the eyes, retroorbital pain. The fever is of biphasic nature, that is, it will be breaking, returning after 1 or 2 days. There might be bleeding from the mouth, nose, gums. Dengue is actually very famous for its muscle and joint pain along with the fever. The pain is almost like as of breaking the bone, thereby it is known as break bone fever. It may be associated with vomiting and diarrhea. Rashes also can be seen in some cases. 2 types. Initially, we may see in 4 to 5 days of the fever, their measles-like rash might be erupted. Or another classic pattern of rash is islands of white in a sea of red pattern, where the whole body will be almost red, but there might be white patches. Like, that's the reason, islands of white in a sea of red pattern. For those cases which do not get resolved under the febrile phase, we move to the next phase, critical phase, which is due to the leakage of plasma from the blood vessels. This leakage of plasma from blood vessels, why is happening, we'll be discussing in the pathophysiology. But the chain of events are, when the plasma gets leaked from the blood vessels, the pressure will of course fall and thereby leading to hypotension. Leaked plasma will go into the cavities. Pleural effusion, if it is going inside the pleura, ascites, gastrointestinal tract, bleeding can be seen. Now the next stage is when this leaked plasma are resorbed into the bloodstream, known as the recovery phase. Here, there will be altered level of consciousness and seizures. These two are happening because of the fluid overload happening inside the brain during the resorption. There will be itching, bradycardia, that is decrease in heart rate, fatigue, prolonged fatigue, and severe prostration will be seen. Another type of rash can also be seen, which is maculopapular or vasculitic, followed by peeling of the skin. So broadly, febrile phase, critical phase, recovery phase, 90% gets over here itself. Some severe cases will move to critical phase, then to recovery phase. This may lead to shock also in certain conditions, depending upon the severity. Now I'll deal about the pathophysiology. The mosquito carrying the dengue virus will bite the human, and the virus enters the skin along with the mosquito saliva and binds to the Langerhans cells on the skin and enters the white blood corpuscles where it multiplies. So how it binds is, these virus will bind to the Langerhans cells, enters the dendritic cell. These dendritic cells are the cells of the skin which helps in identification of any pathogen. In this case, this virus. So this virus will attach itself to the receptor on the dendritic cell, and these dendritic cell, while moving to the lymph node, processes the virus inside, making them as mature virus, and they expel it via the exocytosis. These expelled mature virus will bind and enter into the WBC, inside where they multiply. Now, how does this viral particle mature? In short, can be seen as the Langerhans cells, they will attach, they'll enter inside the endoplasmic reticulum, they'll produce the viral protein, whereby there will be replication of the viral RNA into the viral particle. Then, via the Golgi apparatus, they'll attach the required sugar chains and glycoproteins, whatever how much they need. This whole process thereby will make them as a mature virus. So these mature virus, once they enter the WBC, will start to multiply. Now these WBC carrying the virus will respond by producing the signaling proteins. Two types of signaling proteins, cytokines and interferons. These two signaling proteins are responsible for these symptoms like fever, body pains, other flu-like symptoms. Along with them producing the symptoms, these interferons will also activate the adaptive immune system of the body. So once they activate the adaptive immune system, it causes the generation of antibodies against the virus. This adaptive immune system happens in any infection. So antibodies are generated against the response of any infection of any virus. Same way, these interferons will cause the generation of antibodies against the dengue virus with T cells. These are the cells which attacks the infected cells carrying the virus. Various other antibodies are also developed. Now what does these antibodies do? These antibodies' primary function is to cause phagocytosis of the viral protein. That is, these antibodies will bind to the viral protein and target them for phagocytosis. But sometimes these viruses will not bind properly and with the antibodies, and thereby these antibodies will deliver these viruses into a part of phagocyte where they are not destroyed but are replicated. So once replicated, obviously the next step is it will cause the increase in the severity of the infection. When the severity of the infection increases or there is replication is happening, the virus production increases and many organs like liver and bone marrow also gets affected. So the severity or the critical phase gets started. Now what happens in the critical phase is fluid from the bloodstream leaks through the wall of small blood vessels that, like I mentioned before, into the body cavities due to capillary permeability, and this is a normal response of the immune system, where due to the capillary permeability, the fluid inside the blood vessels will be leaking outside into the cavities. Now once the fluid is decreased, definitely there will be fall in the blood circulation. When there is fall in the blood circulation, the pressure also falls, leading to hypotension. And altogether there will be insufficient blood supplied to the vital organs, leading to the shock or dengue shock syndrome. Also, there will be dysfunction of the bone marrow along with the fluid leak of the bloodstream through the wall of small blood vessels. There will be dysfunction of the bone marrow due to infection of the stromal cell. Stromal cells are basically the functional cell of that particular organ. Here about the bone marrow, like connective tissue cells of any organ, which support the function of the parenchymal, meaning the functional cells of that organ. So in severity, the fluid leak happens, dysfunction of the bone marrow happens. Now, dysfunction of the bone marrow causes fall in the number of platelets, which is the important diagnostic feature in identification of the dengue fever. And this fall in platelets will thereby cause the increase in the risk of bleeding, leading to dengue hemorrhagic fever or other major complication like dengue shock syndrome. This is basically the pathophysiology happening from the mosquito bite carrying the virus, dengue virus. So like I mentioned before, due to the increase in the cases of dengue, we'll be discussing about the classification also. World Health Organization in 1997 had classified dengue in different patterns as dengue hemorrhagic fever, dengue hemorrhagic shock, dengue fever, and classified fever. But in 2009, the classification has been changed to two broad groups as uncomplicated and severe. The severe cases has dengue fever along with severe bleeding, severe plasma leakage, which causes the dengue hemorrhagic fever of the prior classification, and severe organ dysfunction known as dengue shock syndrome. Other uncomplicated cases, like we have mentioned before, febrile cases, falls under this classification. The lab tests: microbiological testing, serological test, blood tests. Microbiological testing, there is isolation of cell cultures, nucleic acid detection by PCR, viral antigen detection. Now these things are not widely available but in all places, but they are accurate and positive. From the start to almost 7 days, we can actually find these tests to be positive. Now, serological tests take positive sign after a few days, where there's IgG and IgM dengue virus specific antibodies can be seen in the blood, which can be seen from 4 to 7 days of the dengue fever. So, Also, there's fall and white blood corpuscles, hemoglobin, low platelet count, less than 20,000 per cubic millimeter is dangerous. It may move into the dengue hemorrhagic fever state. That is critical phase. Also, metabolic acidosis is seen. Moderately high AST and ALT from the liver. Severity shows raise in hematocrit. Now, why is this raise in hematocrit? That shows increase in the heme concentration because there is leak of plasma from the blood vessels and only RBC concentration can be seen in the hematocrit value. Diagnostic. And dengue. Also hypoalbuminemia is seen. Ultrasound are also used for early identification in case of dengue shock syndrome where the fluid fills the cavities, thereby causing damage and a low in the blood supply towards the organs. The fall in the blood pulse pressure, less than 20 mm of Hg, tachycardia, cold extremities. All these are the basic symptoms of dengue shock syndrome, but the others are the investigations. So this is what dengue is about in short. Part 1. Next part we'll be discussing about